Have you ever really wondered what happens after you leave the doctor's office? Well, for a ton of clinicians, the work is just getting started. Today, we're going to dig into a huge problem in healthcare, this thing called administrative burnout, and look at a potential AI solution that promises to give doctors back their time and maybe even their passion. All right, let's get into it. So, first, we really have to understand the sheer scale of the problem we're talking about. This isn't just about a few late nights here and there. This is a systemic crisis that's hitting the medical community hard. Just take a look at this. This image, it pretty much captures the new normal for countless doctors and nurses. The last patient is long gone, but the doctor is still there, basically chained to a keyboard, putting in what they call a second shift that's all about paperwork.
And yeah, it actually has a name: documentary burnout. This is not your garden variety exhaustion, it's a very specific crisis, and it's fueled by this relentless, overwhelming demand for clinical documentation.
And get this, the numbers are just staggering. A 2024 World Health Organization report found that 78% of doctors feel burnt out specifically from these administrative tasks. I mean, think about that for a second. That's almost 4 out of every 5 doctors. And here's the kicker. It's because they're spending more than 10 hours a week just on clinical notes. That's more than a full workday, every single week spent typing instead of actually treating patients. It's wild. And what's the result of all this? While nearly half of all doctors say they feel completely exhausted because of this paperwork, it's not just draining their energy, it's draining their love for the job. This phrase from our source material just says it all. The mission, the desperate need, is to free clinicians from the tyranny of the keyboard. It paints this picture of the keyboard not as a helpful tool, but as a total oppressor. So if technology is a big part of the problem, could a different kind of tech be the solution? Well, this is where a whole new generation of AI tools is stepping onto the scene. The idea is actually pretty simple, and honestly, kind of brilliant. An AI scribe. Imagine this. While the doctor is just having a normal conversation with a patient, an AI is listening in the background, quietly taking all the notes. It's designed to be like a clinical copilot. And really, this is the ultimate promise, isn't it? It's not just about being faster. The real goal here is to get rid of all that soul-crushing admin work so doctors can remember why they got into medicine in the first place, to help people. Okay, so how does this thing actually work in a crazy busy clinic? Well, the whole process is designed to be as smooth and invisible as possible. Let's just break it down. Step 1, the doctor hits record and just talks to their patient, totally normally. Step 2, the AI takes that audio, transcribes it, and, this is the magic part, it automatically organizes it into a proper, structured clinical note. And step 3, in just a few minutes, a draft is ready for a quick look over, and then boom, it's exported. No more late nights spent typing. Now, it's super important to be clear about what this AI is not. It's an incredible scribe, right? It transcribes, it structures notes, it makes everything faster, but what it doesn't do is suggest a diagnosis or check for drug interactions or handle billing. Its purpose is totally laser-focused on one thing: ending that tyranny of the keyboard. But the benefits here go way beyond just saving a few hours. We're talking about something that could fundamentally change how medicine is practiced. The big headline number here is just breathtaking. The claim is a 95% reduction in the time doctors spend on paperwork. And no, that is not a typo, 95%. So what does that number actually mean in the real world? It means getting back those 10+ hours every single week. What could a doctor do with all that extra time? See more patients? Maybe do some research? Or, and this is a big one, maybe just go home to their family on time. And that leads to this really simple but powerful idea. Zero writing means total attention. When a doctor isn't staring at a computer screen, they can actually make eye contact. They can listen better. They can bring back that vital human connection that's at the very heart of healing. Our source material calls this tech an anti-burnout engine, and I gotta say, I love that description. It's so active. It's not just a passive tool, it's an engine designed to directly fight the fatigue that causes so many good people to leave medicine altogether. Of course, none of this works if it's not secure and robust, right? So it's built for the real world. That means total HIPAA compliance, it can understand over 20 languages, and it's adaptable to more than 50 different medical specialties. And all the while, it's creating notes that are legally defensible. It's the whole package.
So what's the big picture vision here? I mean, if this tech gets widely adopted, where does that lead us?
Well, it all comes back to this image, really. A future where the doctor's focus is lifted off of that glowing screen and put back where it belongs, on the human being right in front of them. It's about completely changing the dynamic in the exam room. The people behind this tech put it perfectly. We don't sell software, we rebuild the human connection in health. You see, this frames it not just as a product, but as a mission. The technology is just the tool to get to a much more human result. And that leaves us with this final question. After everything we've looked at, the burnout crisis, the promise of these AI scribes, it feels incredibly important. Could the very future of compassionate, effective medicine actually depend on something as simple as freeing our doctors from their keyboards? It's a pretty powerful thought to end on.